Welcome, friends, to the TeleWellness Hub podcast, a space where listening is not just a simple passive act, it's an act of self-care. I'm Marta Hamilton, your host, and this is a new segment of our three-part series on ketamine-assisted psychotherapy. We are joined by an expert in this field, Crystal Myers. She's a licensed professional counselor and owner of the group practice LifeWorks Professional Counseling, which is based out of Virginia. If you haven't checked out part one of this series, I recommend you to, because I talk with Crystal in depth about this. And she is also joined today by a client who has worked with Crystal and has benefited from ketamine-assisted psychotherapy. Sarah, thank you so much for graciously sharing your wellness journey with us today and for joining Crystal and I.
Thanks for having me. I'm honored to be here.
Before we hit record, in going back and forth and scheduling this appointment, I was just very, very grateful that we were able to have this conversation, because I think that there are many people who are interested in learning more. I actually sent some questions out in preparation for today for the general audience of what are some things that you wish you would know about, or what would you want to know from someone who has pursued therapy and then also decided to try out ketamine-assisted psychotherapy. And one of the things people had asked is, well, how do I know if I should try ketamine-assisted psychotherapy? A lot of it was regarding wondering, I've tried out these other methods. And so I'm curious if you don't mind sharing with us, when did you first start pursuing therapy in general, and maybe what therapy methods you had tried before trying ketamine?
Absolutely. My therapy journey began in 2011, and I just really had no idea what I was doing, but knew that I wanted to be more like into meditation and mindfulness. So I engaged in talk therapy with more of a mindfulness meditation kind of route, but that really wasn't helping me, and that was through a different practice. And then I came to be connected with Crystal, and we were using methods more like EMDR, CBT, and somatic therapy to help treat just complex PTSD and lifelong just things that I had been dealing with my whole life. And I got a lot out of the years that we worked together, and was able to kind of take like a little therapy hiatus, and then experienced a car accident a couple years ago, and that kind of put me back in to this feeling of you're just white knuckling it, nothing's helping. You're ready to do the work, but you just need this extra push to help you get there. And luckily, the time that we live in, what's going on in the world, and the changes around the purposes behind ketamine just all kind of seem to align with the timing of my, need for something drastic to help with my symptoms. And that's how we were able to connect the dots and begin this journey about 6 months ago.
Wow, that's incredible. I appreciate you sharing. I think especially because sometimes in general, we could paint therapy as this really like it feels good kind of journey, but it is such hard work. And I've gone through therapy myself, and I know sometimes the struggles of finding the right fit, even just searching, finding the right fit, trying out new methods. I mean, you described, the mindfulness and EMDR and CBT and somatic work. And that's a lot to try to figure out, especially, I have in graduate school, you receive some training, or you might pursue training and continuing education, but there are so many techniques, so many approaches, and it takes a lot of vulnerability to kind of say, okay, here's my life, and I'm going to entrust this person with you guiding me through these symptoms I'm having, and through my life, sharing. It's a very The therapeutic relationship is so important and valuable, and it sounds like the timing came just right with the right person for you, and I'm so glad for that.
Thank you. I am very blessed to have Crystal in my life.
Yeah, Crystal, I've said this before. I mean, you're just it's just colleague to colleague. I really hear just your professionalism and your care and your heart for your clients and your work. And I think, if I could, for anyone listening who's wondered about therapy, I think finding the right fit is important. And I think just hearing now, sometimes someone might be a great therapist, but maybe it's not the right approach or technique for you and what you need. But finding that right fit, when you find that right fit, it is amazing. So Crystal, just as a colleague, just amazing work that you're doing. Even just you sharing on this podcast, trying something new, and being on a podcast and sharing with so many, bringing value to so many listeners. I mean, you both. It's just really an amazing gift to people.
Thank you. And it's been quite a blessing to work with Sarah. She shows up with courage, and I don't know that she's aware of the depth of her strength, and she's learning to use that strength for herself. And it has been such an incredible experience watching her navigate this and learn to love herself.
I think that strength you mentioned, I'm curious about, because what I'm hearing you say, that you started your journey in 2011, you're trying different techniques, you do a hiatus, you try something new. That does take a lot of courage. It does take a lot of strength, a lot of resilience in that. I'm curious if when you first heard about the use of ketamine potentially, you said I needed something, a drastic change or something major. Were there any hesitations, or did you feel all in right away? I'm curious about just kind of your initial reaction with it.
Yeah, that's a great question. My initial reaction was just to compare, I guess, my life experience to the medication. And I didn't see how it was going to help me because I'd only ever experienced people abusing it or using it at music festivals or in their personal life. So I really didn't take it seriously, and I thought more that MDMA or psilocybin therapy may be something that I'm less afraid of, so to speak. Like when I think of ketamine, I'm thinking surgery, incapacitation, and just think I'm such a control freak. I want to have my, I don't like disassociating and not being in my body. So it really just did not make sense to me at all. Crystal has recommended endless books that have just really helped educate me on the power behind using a medication as it's intended, and just helped me understand by getting me connected to the psychiatrist that prescribes it, just how this, I guess it's an off-brand use of the drug, it can really change the way your brain works and create new neural pathways so that you can experience your life differently than you ever may have remembered.
Sarah, it just sounds like such a place of empowerment to have the opportunity to read, to gather your own knowledge, your own perspective, to speak with the other professionals as well. You mentioned the psychiatrist, being able to coordinate and connect that way. I'm curious then, when you saw these changes, what did you notice in terms of benefits or changes before and after the ketamine?
Definitely. So I guess like the days after the treatments, the most immediate effect was just the relief. I felt like my sleeping and eating patterns were well regulated. My mood was stabilized in that, like, it's easier to get back to baseline and not stay in a triggered state, and
Mhm.
really just having that time to do like writing exercises or self-reflection has helped me just really connect the dots uh, for all my behavioral patterns and every feeling that I've experienced. I think the greatest change I felt was feeling my feelings and not
Mm.
over intellectualizing everything or trying to rationalize that, if you just do these 3 steps, then you'll be fine. You can be normal. Like that any of that sort of judgment just disappeared, and I was able to just finally feel my feelings, understand where they're coming from, and just have grace and patience with myself.
Mhm. Yeah, Sarah, I think one of the biggest things for me was the day that you came in and we were preparing for a ketamine session, and you said, my brain and my body are finally communicating. I've never experienced that before.
Exactly. I think when you just get used to living with, on one half of your brain,
Mhm.
it's really life changing to feel whole again and to have um, just a spectrum of emotion instead of like just getting through the day and surviving all of these feelings and moods that come up without understanding why.
Mhm.
Sarah, that's so impactful. I'm hearing that you felt this even just days after. Like this is you had, I guess, your first session, or I don't know how many sessions you've done total, but even after your first session, just a sense of freedom, a sense of relief. And in talking with other people, there's just that sense. What you're describing is, I had heard just like the ability to feel your feelings, to not have judgment. Really, it sounds like a place of freedom and being able to live in a way, I guess, that you hadn't before, to have an openness. And I know you stated the first session, correct me if I'm wrong, was about six months ago, right? So did is this something that you started experiencing since the first time and it's continued and grown? Or I'm curious about what that's been like in terms of how you've experienced these amazing, like with sleep and eating. Does it build upon itself? Was it pretty immediate?
Absolutely. So, yeah, I would say it has an extreme trickle down effect because once you're able to self regulate and manage your emotions, then you can really start to tackle um, your life goals. So, for me, that was to be um, no longer a people pleaser and
Mm-hmm.
to really just reclaim myself, my self love. Even if it came down to disowning or not talking to family members or people that are unhealthy for me. So just really showing up for myself.
Mhm.
And I guess another way that I felt this change is that during our treatments, I was laid off from a job I had of 9 years. And
Wow.
yeah, my response to that, the day of, it wasn't a beautiful reaction, but in the weeks and months, and now it's been almost 7 months since, my reaction to the hell that is our job market right now, the interviews, the applications, the rejections, is 1,000% different than what it would have been just a year ago without this treatment.
Wow.
I, yes, I asked Crystal, is this indifference unhealthy? Like, am I just being manic? And
Yeah.
she's like, no, no, this is you managing a major life stress and not beating yourself up, and just
Mm,
still putting in the hard work and doing the things you know have to get done. But you know your self-worth. You're not going to take the first job offered to you. You're gonna, fight for yourself in the way you haven't been able to show up for before. And that, I feel like, is happening. I found out yesterday that I have possibly landed a dream job. So
oh,
not to like
wow.
act like this is a fairy tale. I mean, stuff changes. I'm going to be realistic, but I'm going to be okay if it doesn't happen, I guess is my point.
Right.
Um, so yeah, just I would say after even just the first treatment and then the subsequent ones I've had in the last 6 months, my strength, my resilience, my ability to regulate my mood, my energy level, it's all just getting better and better. And I feel for the first time in my life, uh, or like a true connection to a higher power, or a God. And I was not raised religiously. I just understand that we're part of something much bigger. And it's not just everything that's been done to you or has happened. That's not all that is. So I think these are probably the most significant changes I've experienced.
Sarah, it sounds like this is so profound. I mean, just as someone that's listening, it's just relationships, purpose, your heart. I just hear your heart and like a healing of your heart and your spirit. And I'm so glad, I'm so grateful that this exists and that you're willing to share so vulnerably with us. And I just think there are so many people hurting. And so often as a therapist, I don't have the training Crystal has. I've wanted more. I've said, I wish I could do more. And it sounds like this is the more for a lot of people.
Yeah, I could only hope that this has the same physical and mental effects on other people. I'm so blessed that it is helping me. I would never want to sell anything as a cure-all. There is a
Right.
lot of work you have to put in. I wish it was as simple as just taking a medication and waking up the next day in a different state of mind, but I'm getting there, and I feel very strongly that this medication can help billions of other people as well.
Yeah, thank you so much for sharing that. Crystal, I don't know in when it comes to recommending, I know you have training in talk therapy, EMDR, as Sarah has mentioned. Is this something that you see possibly benefiting a lot of people? I remember part 1 of our series, we talk about who it might benefit and how you do different screeners. But is this something that you have seen with other clients, such as Sarah, typically benefiting from the first session? I hear this a lot. I started doing a lot of research for this podcast, and I'm seeing just the data is amazing in terms of the benefits for people who have been searching for hope for years.
Yeah, it's Sarah mentioning the fact that, it's not this magic panacea, but pretty consistently after the first session, people are experiencing growth. And a couple of people after the first one have come back in, or we process a little bit before they leave. And some of them will say, well, I don't really feel anything different. I'm not sure that worked. But then they come in the next day and we have another psychotherapy session to try to reinforce those new neural connections. And pretty consistently, they're able to say, I experienced this. I'm not as anxious. I'm able to leave the house, whereas before I wouldn't be able to do that. I don't have to make myself do these things. And there is a mood lift. And again, like Sarah said, you have to put the work in. And some of the ketamine sessions, I just want to be honest, can be very intense. People process a lot of body trauma that's stuck in their bodies. There can be pretty intense emotions. But I think, as Sarah was saying, it's that understanding that this is now giving me access to a part of me that I'd cut myself off from, and I'm living through this. I have someone here who is monitoring, and I trust them, and I'm going to get through this. So it just builds those experiences that it's life-changing for me to witness. Yeah.
And Sarah, if you had a loved one, a friend, someone who approached you and asked you, I know hopefully I believe that this conversation will bless so many, you sharing this, that there will be healing and value for listeners who may share with their loved ones or themselves. If you had a loved one, a friend, a family member, someone you love dearly approach you and ask you, hey, I'm thinking about this, what would you say to them?
I would probably tell them all of the benefits, and I actually have shared this with a few relatives and close friends. They're just really going through a hard time right now and have also been in therapy for years or tried different medications. I would tell them, like, you don't have to keep white knuckling this or overworking and ignoring it. This has worked really well for me, and you deserve peace. And even beyond that, I would probably offer myself, like, you need a ride to get there. You need help financially with this sort. Like, this is something I believe so strongly in, people at least trying once just to see how it can benefit them. I would fully support their decision and answer anything they needed to know about my experience.
Well, thank you, Sarah, for sharing with us, with me, and with those listening. And though they may never get to meet you and ask some specific questions, I feel that you've shared so much and really have given a full picture, so that those who may want to know more can get in touch with Crystal, or seek out other providers in their state. And truly, I think I have been blessed by this conversation with you, and I'm sure many listeners are as well. And so thank you both. Thank you, Sarah. Thank you, Crystal, for joining us, and Sarah for sharing your wellness journey with us today.
Thank you so much for having me on.
Thank you, Marta.